Is there a stigma attached to CF carrier status? Imagine discovering you are a carrier for cystic fibrosis and wondering how that might change how others see you. Being a carrier means you have one copy of the faulty gene that causes cystic fibrosis, but you do not have the disease itself. While many people see carrier screening as a helpful tool for family planning, some individuals do experience social or emotional challenges related to their carrier status. Research shows that some carriers feel a sense of stigma, which can influence how they view themselves and how they interact with others. For example, some carriers report feeling less positive about themselves compared to people who are not carriers. This might be due to misunderstandings about what it means to be a carrier or fears about passing on the condition to future children. There is also concern that others might wrongly see carriers as undesirable or worry about social judgments, especially in communities where genetic conditions are misunderstood or stigmatized. Health professionals have noted that carrier status can sometimes cause stress in relationships. If one partner is a carrier and the other is not, it might lead to worries about reproductive choices or fears about passing on cystic fibrosis. Some carriers also feel pressure from peers or family members, especially if they are told that the information about their carrier status is not relevant until later in life. This can make communication about genetic risks more complicated. Despite these concerns, many carriers and their families support carrier screening programs. Knowing your carrier status can give you the power to make informed reproductive choices, such as considering options to prevent passing cystic fibrosis to children. This knowledge can be very empowering and is often viewed as a positive step toward family planning. The key to reducing stigma is education. When carriers understand what their status means and receive supportive counseling, they are better equipped to handle social or emotional challenges. Clear, compassionate communication helps dispel myths and promotes understanding. It is important to remember that everyone's experience is different, and not all carriers face stigma or negative feelings. In the end, awareness and open conversations about genetics and carrier status can help normalize this information and reduce any associated stigma. If you or someone you know is a carrier, talking with healthcare professionals and genetic counselors can provide support and accurate information. Always seek personalized advice from medical experts to understand your own situation fully.